We are recording, but we're not streaming live, but it will be available as soon as it's uploaded after we've concluded today's events. Thank you very much. Today we are, if everyone could please mute on entry from the press and everyone else, that would be grateful. We would be very grateful because it creates noise in the background. Thank you very much. Today we're joined by Rosin Harris from Public Health England. We're joined by Councillor Jonathan Nunn, from the leader of Northampton Borough Council. We're joined by Councillor Tom Beattie, the leader of Corby Borough Council. We're joined today by Dr. Joanne Watt from the Primary Care and GP and the CCGs. We're joined by Becky Bradshaw from the University of Northampton, and we're joined by Simon Blatchley from the police. Thank you very much, everyone, for attending. What we're going to do is how we normally do it. So we will go to Rosin Harris for the update of the weekly figures. Then we will come to Councillor Jonathan Nunn for a perspective on the local situation. And then we'll come to Councillor Tom Beattie. And then we will come to Dr. Joanne Watt for her view on the CCGs and all primary care matters. Thank you very much. And then we will come to questions which have been submitted in advance as previously. And if anyone's got any subsequent questions, if they could please raise their hands using the chat facility. Thank you very much. So we'll come to Rosin Harris first to run through this week's figures. Thank you, Rosin.
Thanks, Councillor Morris. Can everyone hear me okay? Brilliant. This week, I'm afraid the surveillance pack has not been circulated or put on the website in advance because we're waiting for the national surveillance report to be published by the government. So instead, if I could just talk through some of the slides we've prepared and some of the figures that will be in the full report published as soon as we get that national surveillance report published nationally. So in terms of headlines for this week, before I move on to the headlines in terms of the figures, case rates, etc., I just wanted to flag that it has been a very busy week for new legislation, regulations. We've had new regulations around face coverings, new advice around working from home, opening hours and table service in the leisure and entertainment industry, new requirements around test and trace, and that leads me on to the new NHS COVID-19 test and trace app that was released yesterday. And just to encourage everyone, everyone who does have a smartphone, to download that app. We're seeing improvements in the number of positive cases that we're successfully contact tracing, but every little helps. So this is another sort of tool in our toolbox for contact tracing that can be really important in helping us reach all those cases and contacts and isolating them as soon as possible so that we can reduce the spread. So just a plea to everyone who does have a smartphone to download the app as soon as possible. If we can move on to the data slides, and I believe we have a selection of slides to present on the screen. Excellent. So from slide 9, the one that you're seeing on the screen, our weekly summary and then the trend from late June in weekly cases. So as you can see in the last week, and this is the week up to the 20th of September. So just a reminder that we exclude the data from the last 4 days because they're subject to change. So up until Sunday, the 20th of September, we saw 136 cases in Northamptonshire during that week. It's important to note here as well, I think on the previous surveillance report, we saw 225 cases in the previous week in this report. That's slightly higher than the figure reported in last week's surveillance report, because there is a bit of a lag, and we're seeing an increasing lag since there's been the lab capacity issue, a lag in in the data being reported. So there are cases that are being reported to us after several days, so sometimes a week delay before we hear about cases. I just wanted to flag that if people notice a discrepancy in those two charts from this week versus last week. Just to flag at this point as well, that although we've seen a reduction in cases in that last week to the 20th of September, this isn't necessarily because we've reduced the number of tests available. We're testing broadly the same number of people as we previously have, but the proportion of tests coming back positive has reduced. I just want to issue a note of caution here, simply because we've had such issues with capacity and demand far outstripping supply in terms of tests available, that may be something that we're seeing is people accessing the testing who previously may not have been tested because they might have very, very mild symptoms or symptoms of colds and flus that are starting to appear, that are now getting tested and therefore pushing that positive figure down. So I wouldn't want anyone to take away the message that we're in the clear, case rates are reducing, everything's fine, and really do want to emphasise that this shouldn't be a point where we relax all those measures that we've been taking to reduce transmission. So on that, if we move ahead to some of the next slides, and you'll be able to see this when the full slides are published later, we've now presented, rather than a population pyramid of the total cases since the beginning of the pandemic, just those cases in the last 28 days, to show the sort of age distribution of cases in those recent weeks, which shows that spike in cases in 20 to 29-year-olds, yes, but also the fact that all working aged population up till around 69, as well as the under 20s, are seeing a rise in cases recently. I want to skip forward now to, so that the next couple of slides will be district and borough breakdowns of figures. But if we move forward to slide 14, because I think that's summarised quite nicely in a graph. Yeah, thank you. And if you'll remember last week, we talked about the Northamptonshire county case rate sort of diverging from the national England rate, and you can see that trend is persisting and that the Northamptonshire rate continues to come down as compared to the national rate. But again, just want to emphasise that caveat that I put on this data earlier. I think it is important to note, however, that all across the country there are challenges in capacity in terms of testing. So I think there is something positive to be said about the measures that we've put in place already throughout the summer, urging people to go beyond what's absolutely required of them in the law and advising more caution. I think we can say that that does seem to have paid off to a degree, but it's just important that we keep that up. So if we move on to the next slide, which shows school status, and again, we'll come to the outbreak summary table shortly, but I think based on feedback from last week's press conference, we thought it would be useful just to show the school status on its own. So showing there that there have been 6 active outbreaks up to the 20th of September, and 23 cases associated with those 6 outbreaks. And a similar picture to that we saw last week. So 95% of schools fully open and 5% of schools partially open. So just before we move on to outbreaks and that outbreak summary table, the next slide should show case rates by community. So by middle super area, which is essentially just a small geography similar to a ward. And we can see that those top 3 MSOA areas, so Corby Village and Weldon, Barton Seagrave and Burton Latimer, remain in the top 3. And the next slide, in terms of that adjusted for the population in those areas, so rather than total numbers, but numbers per head of population, it's the same population. So I think a slightly different order in what comes first, second and third, but those MSOA areas still prominent. I would like to just point out when we show this slide that we are showing cases in the last 28 days, so the month average. So week to week, we're unlikely to see a huge change because a month a week ago is fairly similar to the month picture this week. But we'll keep a watching eye on those MSOA levels. Finally, to come to the summary of outbreaks and exposures. I think that will be on slide 20. Thank you. We have seen an increase in outbreaks and exposures. First of all, our active outbreaks have increased from 26 last week to 39 in this week to the 20th of September. I do want to point out that the care homes outbreaks, particularly, as you'll see, have increased from 13 to 21 in this report. As I say, this is up to 20th of September to up till Sunday, and I am aware that at least 7 of those outbreaks were older and have since been closed. So this is only active outbreaks. So if there's been no positive cases in the last 28 days, those outbreaks are then closed. And just to mention again is that we're still within that 28-day time frame for the Green Corps outbreak, so those cases remain in the log, but next week won't appear. Total outbreaks and exposures have increased from 76 to 113, you'll see down the bottom, with the total cases associated with those increasing from 458 to 520. I think it is really important to note here that taking away those 300 cases associated with the Green Corps outbreak, the majority of these outbreaks or exposures, if they're exposures, they're single cases that are being identified, and the majority of the outbreaks are 2 to 3 cases. So I think that's a really positive sign that, particularly in care homes, that the routine testing that's happening in care homes is identifying positive cases, mostly asymptomatic cases in staff and residents, and sort of closing down that outbreak as soon as possible. So we're seeing 2 to 3 cases and then no further cases appear, which is really positive and in stark contrast to some of the outbreaks that we were seeing in care homes at the beginning of this pandemic. So that's a summary of all the data pack that should shortly be available on the county website. And so I'll hand back to Councillor Morris and we'll have summaries from others.
Thank you very much, Rosin. A very thorough going through of the figures, as always. I'm going to bring in Councillor Jonathan Nunn now, the leader of Northampton Borough Council, to give his update on his view as to how the week has gone. Jonathan, over to you.
Well, thank you, Ian, and good afternoon, everybody. Yeah, our celebration has been stolen from us, really, hasn't it? As through the weeks, we've fought hard to get near what we might have considered national averages, and as we do that, we now realise that actually we've still got perhaps as much trouble as we have. For all the great work that people of Northampton have done, the little jig that certainly I had in my mind to do when we started to get those figures way down has been stolen from us. And I wonder if that's a symptom of what this virus has done, because it's stolen from us our right and capability just to turn up and go to work as normal, hasn't it? It's stolen from us the right to attend funerals and weddings and important matters with loved ones. It's stolen from us the right to develop as a young teenager into a student who can go away and fulfill that important part of development into socialising with others. So many things have been stolen from us. But I think the message is we have to allow them to continue to be stolen. We have to do all of the things that we've been asked to do nationally, and actually all the additional precautions that we've done locally, the extra messages we've stressed around car sharing and public transport and so on. Really, really sorry, and I wish it was different. We've just got to stick with them. That good news, again, we mentioned this before, is that actually Northampton has been a beacon, or certainly a good example of what people can do. If you look at what we've done, our numbers, it shows that actually it is within people's hands, towns' hands, but each individual's hands to, you know, change the tide slightly. But we're not there yet. We're far from there yet, and that's a real shame. So complacency remains our biggest enemy, really. And whilst we see additional things coming in, there's a question later about the 10 p.m. curfew and the economy, and indeed also about promotion work that the Borough Council is doing to get people back into the town centre. And I'll be glad to talk more about that. But the reality of it is we can't avoid, and we can't yet reclaim those things that have been taken from us by this virus. We still have to stick to the precautions that have been talked about, and that there is no perfect answer. Balancing the needs of health, of education, of the economy and everything else, there is no perfect answer. We've just got to stick, I think, to the precautions that we have adopted so far. Let's see this thing through, but let's not give up now, because there is a precipice to fall into, in my layman's view, if we don't stick to that careful behaviour that we have. Ian, glad to chip in a few comments later, but I think overall that's my current sort of feeling on things.
Thank you very much, Jonathan, and I think we all echo your views there. I'm going to bring in Councillor Tom Beattie now, the leader of Corby Borough Council. Tom, over to you.
Yes, thank you, Ian. I hope everyone can hear me. I'd just like to reinforce the message which Jonathan has just given about complacency. We have been reinforcing messages, you know, for the last few weeks and longer. Looking at the figures that have been presented, there is some room, I think, for a bit of optimism, some cautious optimism about whether that we might hear some good news from the government later about whether Corby still remains on the watch list. But until we hear that, we don't know. And I would continue to urge people to follow the guidance that we've been given around things like sharing cars, public transport, the wearing of masks, social distancing, all of those things. Because that seems to be having an impact. If the figures are coming down as they appear to be, that would seem to be working, and we need to continue to do that. With the new measures introduced this week, the tightening of restrictions, I know those. And Jonathan has very accurately described the impact that has had on people's day-to-day lives. But I think it's important that those new measures are enforced. I mean, I was in a town centre restaurant in Corby yesterday at lunchtime, and they were very, very careful to follow all of the guidance that's been given about table service and ordering and paying. It may be, it took a little bit longer than it would normally take to order and pay for your food, but I think that inconvenience is worth it if we can drive this virus down, and in fact drive it away completely at some time in the future. So the message is that we continue to do what we have been doing. We don't get complacent, even if, you know, later on today we hear some good news from the government. I would still urge people to continue to do what we've been asking them to do over recent weeks, and to follow the recent guidance and in fact recent restrictions, some of those legal restrictions which the government have now introduced and we can all hopefully at some point get back to something approaching a normal life. Thank you, Ian.
Thank you, Tom. Again, I think we all echo those views. I'm going to come now. We've got a new face for this afternoon. We've got Dr. Joanne Watt, live from her practice, to give a primary care update and on the specifically. Joanne, over to you. Welcome.
Thank you. So thank you, Councillor Moores, much appreciated. I think it is very much a case of making sure that we continue to look after the population. Although there are still significant numbers of cases, most people are able to look after themselves at home, are not needing a lot of healthcare. The really difficult thing is you don't know if you're somebody who's going to get the more severe form of the disease, who is going to require admission to hospital or an intensive care bed. And if not you, then your friends, your family, or your loved one. So it's not just about protecting yourself from the disease, it's about protecting the people that you care for and the people that you have contact with as well. And that's why it's so important that people do follow the guidance, because it's not just about you, it's about everybody within our communities, and it's really important. It's important to say that actually in primary care and in general practice, it is very busy. There is a lot of activity, a lot of people are consulting with GPs, with practice nurses, and we continue to consult with people mostly remotely in order to keep you safe and in order to keep staff safe as well, that most contacts will continue to be remote, although there is always the facility to see people face to face where there is a clinical need to do that. So if people are worried that they have cancer or something serious, their GP practices are still there. And obviously we encourage people to make sure that you don't run out of medication, you look after yourself, particularly if you have a long-term condition. These things are really, really important. So please don't forget about all your other healthcare needs. COVID is serious and potentially extremely dangerous, but a lot of the other conditions, it's really important that you continue to look after yourself. We appreciate it is difficult at the moment. Things don't happen in the way that you would expect, but we would encourage people to continue to look after their health, and as I say, particularly if they have a long-term condition. And for those people with long-term conditions and over the age of 65, if you are eligible for a flu vaccination, that's one of the things that you can do at the moment to look after yourself, because in the middle of all of this, you do not want flu and COVID at the same time. So we would absolutely encourage people to get their flu vaccinations. If you've had the reminder, please do contact your own registered surgery to get that done. Obviously, pharmacies are also available for people who prefer to have it done that way. But it is really important to look after yourself generally, but also look after the people around you. Please do follow the advice. And if you are attending a healthcare setting, as with other settings as well, please do use a face covering. It is really, really important to do that, to protect other people around you, and to protect the rest of your friends and family as well. Thank you.
Thank you very much, Joanne. Very, very good input there from you, and from the CCG angle. Thank you very much for that. I'm going to move now to the questions that have been tabled. The first one is from Ben Waldron from Northants Live. Ben, are you there?
Hello.
Hi, Ben. Good afternoon. How are you?
Yeah, very well, thanks. Hope you're all the same. Yeah, thank you all for your time this afternoon. I just wanted to ask whether there has been any kind of localised outbreaks of coronavirus this week across the county, kind of on any specific streets or at a certain business or a certain site that you're able to tell us about. And then secondly, in terms of our hospitals, has there been any specific preparations made to kind of handle with this kind of second wave of cases we're seeing at the minute?
Thank you very much, Ben. I'll come to Rosin first for the first part, then if Joanne's happy to answer the second part. Rosin, over to you. Thank you for your question, Ben. Thank you.
Yes, and just going back to the data pack that we showed earlier, we have had a trickle through of outbreaks as we have over the previous weeks, but all of those have been relatively small, so 2, 3, 4 cases. We've not seen any large significant outbreaks in that week for the report. And any significant outbreaks that have sort of implications for public health and well-being or have implications for the wider public, we will be communicating with the public about. But the majority of the outbreaks that we've heard about are relatively small, which is really good news at the moment.
Thank you, Rosin, but a good answer. Dr. Joanne, thank you.
Yeah, so I have been in close communication with the medical directors from both of our acute hospitals. There are detailed surge plans in place. There is a lot of experience from the first wave at both hospitals about how to expand their intensive care capacity, how to make sure that people are discharged from hospital when they're ready to go home, and that's something that they continue to work on. And both are ready to expand their intensive care capacity should the need arise, and they will activate those plans if those limits are reached. It would be much better if we stop people from acquiring the infection in the first place. Hopefully we won't need those, but those plans are very much on standby and can be activated extremely quickly.
Thank you very much, Joanne. Ben, did you have a subsequent question, or I can probably move on if you're happy with that?
No, that's everything from me. Thank you very much.
Thank you, Ben. Then we come to Alistair Ulk from the Northampton Chronicle and Echo. Are you there, Alistair?
Hello there, can you hear me?
Hi, good afternoon, Alistair. Hope you're well.
All right. How's my microphone this week? Can you hear me at all?
Yes, we can hear you. Thank you.
Okay, thank you very much. I wanted to ask maybe Rosin and anyone else who can jump in. We're a few weeks in now into schools being back. The Chronicle has been running quite a few stories about, of course it relates to bubbles at a time, but it's relating that entire year groups are going home at some point if there's a COVID case connected. Of course that depends on the size of the school, the size of the year group, but it eventually lead to whole Europe's going home. I guess I'd like to ask, do they think there's a way this model could be refined going forward, or is it do you think this is working as intended? I think it was proven quite chaotic for a lot of parents so far, especially in trying to get a test on top of that when a whole classroom has to go home. But it depends on the size of the bubble, of course. Does this process need refinement, in your opinion?
Thank you. I think that's probably a two-part answer. So I'm going to go to Paul first. Paul Andrews is a member of our education team. We'll start with Paul, and then Rosin, you may want to chip in on that as well. Paul.
Yeah, thanks, Councillor Morris. I think it's a tricky one because a lot of the things schools put in place are untested. So they're learning by experience. The DfE guidance effectively asks them to balance two things, which is infection prevention and control, and the delivery of a full curriculum. So what they've imagined they need to put in place at the start, they'll be learning by experience. So I'm sure as they work through this and as they get cases, they will be refining their risk assessments and learning as they go on. I think it's also very circumstance specific in terms of the phase of school. So the approach in a secondary school will be very different from the approach in a primary school. And although at the moment we are seeing some year groups, whole year groups, we're also seeing other schools where very limited numbers of young people are having to isolate. And looking at the data across the piece, I think the number of young people that are isolating is broadly similar from week to week. So although we're not complacent about that, we're actually fairly comfortable and fairly confident that things are going as well as could be expected, seeing as this is something that's never really been addressed before.
Thank you very much. Just to add to that, if that's okay.
Sure.
In the slides it's just a quick one. In the slides that we were shown, there was a stat saying that as of the 20th of September, it said 89% of pupils attending, average of the previous week. But anyway, 89% of pupils are attending school then. Can you give us that in how many students there are? Are you able to give us that information? Sorry.
Paul, I think.
Sorry.
Carry on.
Not off the top of my head. That percentage is I haven't got the data to hand. In terms of the numbers, we can probably look at that and see if we want to include numbers in the slide.
Okay.
Is that okay?
Yeah, I think that'd be an interesting stat. Thank you.
Thank you, Alistair. Thank you, Paul. Rosin, did you want to make any comment on that question specifically?
No, I think Paul's
answered it very ably. So we'll move on to, I know you've got some more questions, Alistair, but I'm doing them in the order that I've been presented them. So I'll come back to you if that's okay. I've got Carly O'Dell from the Chronicle and Echo. Carly, hi, good afternoon.
Hi.
Hi.
I just wanted to ask the police representative on the call if they'd issued any further fines this week due to breaches, and whether they were in any specific general areas at all, please.
Thank you very much. Thank you for that question. Over to you, Simon, from Northamptonshire Police. Thank you.
Thank you, Councillor. Yes, we have issued 3 tickets yesterday for breaches of the rule of 6, basically, in Northampton, linked to the university. But to be clear, we're getting calls from members of the public now. There has been a rise in our calls from the breach of the rule of 6 generally across the county. What we're doing is we are putting out the comms, and we will be stepping up as much as we will be engaging, explaining, encouraging, as we have done before with the new legislation. We will be enforcing more than we have done previously at the request of the government. I mean, there is an argument now that this has been going on for 6 months, so people should be aware. The new legislation is there, so we will be proportionate and encourage people, but where we have clear and flagrant breaches, we will now be stepping up activity. We will be keeping on additional resources over the weekend for the nighttime economy. As you'll be aware, the curfew's in now. My hope is what we've seen previously across Northamptonshire is 99.9% of the population are fairly compliant. So we will just be dealing with the extreme ones and be working closely with our partners to engage and explain our activity before, and only use enforcement when absolutely necessary. I hope that helps.
Thank you, Simon. Carly, did you have a subsequent question? I know you've got a couple of other questions, but I'm going to, if you're happy with that answer, I'm sure you are, come back to Alistair because he has a further question, I think. Alistair, did you have a further question? You've got a couple.
Yes, thank you. Thank you. Yes, 2, if that's all right. We'll start. One for Rosen, if that's all right. For Rosen, earlier this week, you said that Public Health Northamptonshire was already considering a 10 p.m. curfew, an extreme measure, I suppose, but you're already considering implementing it. That's come along naturally as a national policy. What other measures do you think Public Health Northamptonshire what other measures does Public Health Northamptonshire think the government should be considering to introduce if they want to sort of curb the spread of the virus? What suggestions would you make?
Thank you. Yes, over to you, Rosin.
Thanks, Alistair. Yeah. So I think firstly, it's really important that we really monitor and evaluate the impact of each new measure when they're introduced, what the effects of them are, and any unintended consequences, because I think that will help us decide what other or new measures we need to take. I know we discussed previously the potential impact of restricting nighttime economy on pushing some of that activity into homes and households. So I think to answer that fully, we need to know what the impact of regulations are and what consequences they might have that were not intended before really recommending any new measures, I think. The other thing to mention is I think we've talked a lot about restrictions in terms of measures to reduce the spread of the virus. But we've been talking in recent days and weeks more and more about more positive and supportive measures that we can take to try and reduce the spread of the virus. So I was really pleased to see the government announcement about the self-isolation payment. I think that's a really positive step. And if we're looking at all sorts of things locally in the county that we can do that provide some extra support, for example, providing face coverings to deprived communities, whatever we can do to add some support rather than add more restrictive measures. Not saying that the restrictive measures aren't really important, but I think we also need to be a bit more supportive as well as restrictive.
Thank you, Rosin. Alistair, did you had another question?
Yes. Thank you very much. Thank you, Rosin. I don't know if we've got anyone from the University of Northampton who I can talk to.
We do have someone. Becky Bradshaw's here, so fire away.
Thank you, Alistair.
Thank you very much, Becky. Thank you. It's I guess it's to ask. first 2 weeks or so into the return of students to the University of Southampton, of course. Are you able to tell us, have you got stats for the number of positive tests for staff and students since they've returned, or if you can tell us if any bubbles are self-isolating?
I'm afraid I can't really comment on the kind of individual cases or sort of small number of cases for fear of obviously identifying individuals in those circumstances. I can confirm that we don't have at the present time a situation like has been mentioned previously in some colleges and schools. But our students are required to follow the same isolation advice as other members of the community if they're symptomatic. So if they are symptomatic, they will be isolating with their household, which will be their other flatmates. But I'm afraid I can't comment on the actual number of those.
I mean, if it's not to be rude, sorry, but I'm not sure how that would identify anybody. It's just to ask if you've got stats of how many bubbles you've got isolating, or if there's any number of cases. I wouldn't say that will identify anybody.
Well, Becky, did you want to answer that? Because I feel you've already answered it. But if you want to have another go, agree. But you have already answered the question, I think.
No, I mean, I was just going to add, Councillor Morris, that as in line with previous briefings, we haven't gone into the detail of individual cases or smaller or the exposures, for example.
Becky, I'm ever so sorry. The second I answered my question, my browser crashed, and I didn't hear any of your response. I'm ever so sorry. I didn't mean to. I beg your pardon. Can I ask you to repeat that? Sorry.
Of course you can, Alistair. I was just going to follow up that just in line with the previous briefings that we've had, we haven't commented on individual cases or exposures where there are small numbers. So I won't be commenting on that, I'm afraid, Alistair.
Okay, thank you very much, Becky.
Thank you, Alistair. Thank you very much for the question, and thank you, Becky, for the answer. Carly Adele, are you there again? You've got another question, I believe. Thank you, Carly.
Yeah, can I just ask Councillor Nunn, obviously I know it only came in yesterday, but what's the kind of initial feedback that you're getting regarding the 10 p.m. curfew, and how do you see it kind of affecting the nighttime economy in Northampton in the near future?
Thank you, Carly. Very good question. Jonathan, over to you.
Yeah, thank you, Carly. I mean, a good question. As you say, early days, and as Rosin said earlier, any initiative you've really got to evaluate. We haven't had the chance yet. I can tell you what the sort of speculation is. Look, I think we'd all admit that part of what happens when people have a night out with alcohol is inhibitions disappear, and we've seen that. There's been plenty of press and media photos published of late nights and so on. I guess also, though, if we're honest, we think more of the later part of the nighttime economy, rather than those restaurants and so on that, as Tom described, having had lunch in Corby. We also, in Northampton, actually, I think there's been a pretty high level of compliance. We've said for a long time, don't go to a restaurant that doesn't offer you a proper tracing opportunity. In practice, I think we may see some changes come, mightn't we? So first of all, 10 p.m. curfew is difficult for many of us who might want to eat out later. The most popular time to book a table in Northampton is 8 o'clock. One of the things that means is that restaurants are trying to encourage people to get in there at 5 o'clock and 6 o'clock. In practical terms, that doesn't work for most of us with our work, as a consequence to which, of course, they may find they only get one sitting of customers, and that's a really significant thing if they're used to those tables turning over once or twice. As a consequence, as one of the most heavily regulated and compliant industries, there's licensing, food standards, and a whole host of other things. Naturally, the local industry is very concerned, and some of them would express that perhaps they're unclear on what the basis is, particularly for more the full dining experience, and they wonder whether this will work. My mind's open. I see the point of it. I'm yet to see. We will make sure we keep in touch with businesses. There could be a problem here. There could be an opportunity if the pure, if you like, the drinking fraternity, find that they bring their drinking earlier. We'll have two different uses going on in the town in a way we've not seen before. Potentially that could bring disharmony. Of course, alternatively, there could be opportunity in this. There's quite common in areas of Europe where you might walk around a town in the evening and the shops are still open. Many of our high quality retailers say that they serve the same market as the high quality restaurants, but they don't open at the same time. So perhaps there will be opportunities and we may see a shift. I think we all know of one key retailer in the town that now doesn't open till later, stays open till 7, and tells me that they do a higher turnover between 5 and 7 than any other time. So there's lots and lots of different things in the air. Personally, I'm concerned if it would cause the economy any harm at all, but I'm open-minded to the opportunities and will stay really close to the whole industry, which is a vital part of our economy, as we evaluate what's going on here. I hope that's a few comments that are helpful. Thank you.
Thank you, Jonathan. Very, very helpful. Carly, did you want to comment on that at all or ask a subsequent question? If not, I'm going, Carly, hi.
Yeah, no subsequent question to Councillor Nunn, thank you.
Thank you, Carly. So I'm going to come to Laura Coffey from BBC Radio Northampton. Hi, Laura. Good afternoon. How are you?
Hi, good afternoon. Yeah, very well, thank you. So I've got a few questions. Rosin, I've got a few questions for you. So Corby and Northampton are still on the government's watch list. That list, as we know, is out today. We'd have probably all hoped that it was already out by now. But are you hopeful that both boroughs will come off that watch list this week, with, in particular, with the rates that you reported earlier? If they are off the list, what does that mean for people in the county? You've obviously had the local guidance in place for many weeks now in Northampton, Corby and Kettering. Wellingborough, it was removed last week. If they're off the watch list, would we see this local guidance removed from those 3 towns? I also, I know you kind of touched on this already, so I think it's probably covered, but just if you could confirm that obviously with the number of positive cases you mentioned that have decreased, do you think this is linked to the lab capacity and the difficulty that people are having across the country, not just in the county, getting tests? And also, we've heard this week more about the vaccines. How is the county preparing for these? Councillor Nunn, Jonathan Nunn, I have a question for you as well. Earlier this week, the Borough Council released a video urging people to rediscover Northampton. This was obviously before the new measures were announced by the Prime Minister. How challenging is it getting people back into the town centre? And with these new measures, will this make it even more challenging? And Becky Bradshaw, this week, Glasgow University confirmed over 100 students had tested positive for COVID-19. Have there been any cases at Northampton University? I know you said you couldn't comment on those with such small cases, but how are you trying to ensure that you don't have a similar outbreak to the one that Glasgow has seen?
Thank you, Laura. As always, a very comprehensive list of questions from you. We'll take them in the order that you asked them. So, Rosin, if you could answer that first section, and then we'll come to Jonathan and then to Becky. I think that probably covers all those questions. Rosin.
Thanks, Councillor Morris. Thanks, Laura. And the first question you ask if I'm hopeful if Northampton and Corby will be coming off the watch list. And I guess the answer to that is a bit complex, because in some ways I think that will be good news that our cases are reducing enough that we are coming off that watch list, but in other ways that does cause me some concern. First of all, because I think that the message that gives to the public might be that, you know, we can relax now, we're off the watch list, our cases are down, we don't need to worry about things. So in answer to your question around whether that local guidance will remain, given the national picture, then absolutely yes. I think we will be still promoting those local messages to be more cautious and potentially spreading those messages wider across the county as the national picture, I guess, worsens. I think there was another question about what might that mean coming off the watch list, and I do want to note as well that because we have been an area of concern, we have had access to additional resources, additional testing capacity that we would not have had we not been an area with high cases. And so should we be removed at one point from the watch list, that extra capacity may be redirected elsewhere. So those are, I guess, my concerns around us coming off the watch list if that indeed happens later today. And the final part of your question, I think, was the number of positive cases and whether that's linked to the reduction in lab capacity. So I think undoubtedly the challenges around lab capacity has had something to do with that recent reduction in cases that we've seen, not because we're testing fewer people, but potentially because the people accessing those tests are understandably, I guess, as the schools go back, understandably concerned about other symptoms, sort of cold, flu symptoms, as we come into autumn, probably have runny noses, and because of the concerns that schools have, understandably are wanting to get tested. We know that the proportion of under 18s getting tested has shot up over the last few weeks, and we know that the proportion of those under 18s that actually test positive is extremely low and much lower than any other age group. And so I think the lab capacity issue has certainly created an issue where we're picking up fewer cases, but that's not necessarily because we're testing fewer people. I hope that answers all three parts of the question.
Yes, thank you. Yeah.
Thank you very much. Jonathan, did you want to come in on the question to you, and then I'll bring in Becky. Thank you, Jonathan.
Yeah, thanks Ian, and thanks Laura for the question. It's a good question, and I guess it's a real classic example of what I was saying earlier about balancing health and economy. Both are important. In regard to the economy, we have, as you rightly say, we've recently launched a video, and there's a variety of different things that will be going on to encourage people to come back to Northampton, but safely. And it is safe to visit Northampton. The last part of your question, will these measures make it more challenging? They probably will, actually, but hopefully what they'll do is still allow people to come in, but they'll just highlight more the absolute need to be safe and follow all precautions. You walk around the streets and people aren't at a bad level of compliance, but actually it's not perfect yet. So let's do more and more and more. We do need, our economy is not, not a secondary issue. It's people's jobs, and it's how they pay their bills and everything. So it is an absolutely vital thing that we get back up and running. But you can come into Northampton safely, and you can have an enjoyable time. It's going to make it harder for us, but our message is yes, please follow the guidance, but please come into Northampton. The retailers tell us that our shopping habits have become more purposeful. That's to say, fewer of us come into town and just meander around and browse so much. We go in with purpose. So the spend is quite good per head, even though the footfall is down. But nevertheless, no, we would encourage people to come in, enjoy the leisure economy, book a table. 6 o'clock is the best time, but do come and enjoy it. You can be safe. But no, our economy desperately needs that recovery. Those people whose tills have not rung for some months during lockdown need that support. But there's lots to see and do. So yeah, come have a safe time in Northampton. Thank you, Ian.
Thank you, Jonathan. I'm going to bring in Becky Bradshaw from the University of Northampton on that last part of the question. Thanks, Becky.
Thank you, Councillor Morris, and thank you, Laura, for the question. I obviously can't comment specifically on the Glasgow case because we don't know the details that's involved in that particular outbreak. But in terms of the plans that we've got at the University of Northampton, I did mention a couple of weeks ago some of the measures that we'd taken around the physical environment. So obviously social distancing arrangements, the requirement to wear face coverings before that became mandatory, alongside a reduction in our face-to-face teaching delivery model, and also alternative plans for Freshers Week and Freshers Week activities that focused around small activities, so that our young people could still have a welcoming experience to Northampton, but they did so in a safe and responsible manner in their groups of 6. We've also been working quite heavily over the last couple of months now, actually, to develop a outbreak prevention and management plan with the local public health team that would both obviously try to prevent cases as much as possible through some of the measures that I've talked about just there, but also to contain an outbreak or contain cases and stop them from developing into an outbreak in our student accommodation or linked to university activities. I think the other point to mention there is the educational element. So as sort of colleagues on this call have all mentioned already, is the vast majority of the population are following the restrictions or the guidance that's in place, and the same goes for our university community. But we have made sure that we continue to educate, we continue to make sure that they are aware of the restrictions that are in place to keep others safe, but also those students as well.
Thank you, Becky. I think it's very important that we don't demonise the young in this process. It's really would be counterproductive in the long run. Laura, are you still there? Did you have any?
No, thank you. That's everything. Thank you very much to everyone for that.
Thank you. Well, we've worked our way through the list of questions, I believe. So I'm going to offer the chance for anyone to ask any subsequent questions if they would like to either put something in the chat or put their hands up. That would be good. Alistair, I see your hand is up. Alistair from the Chronicle and Echo. Alistair, over to you, sir.
Hello again. Sorry, running off the back of saying we don't want to demonise young, I'm about to ask about the breaches that Simon Blatchley mentioned about 3 tickets issued yesterday in relation to the university. Was that correct? Sorry, Simon.
Simon, are you still on the call? Simon, hi.
Yes, still here.
Thank you. No, it's just that I wanted to double check my notes. You said that there were 3 tickets or 3 actions taken yesterday in relation to breaches of the Rule of 6 in relation to the university, was your phrasing. Is that correct?
Yes, that's right.
Okay, thank you. In that case, Becky, has the university been involved with taking any action in relation to those 3, or were you notified about the breaches?
We were notified about the breaches because the action was taken by our own on-site campus police team. So I don't know if you are already aware, but the University of Northampton invested in a small team of police support a couple of years ago when we moved to our Waterside campus, and that enforcement action was taken by those individuals yesterday. So yes, we are aware, and we're working with our local team to also tie up from a student disciplinary point of view in the background. But I would just like to stress, as we've just said there, this is a very small minority of students. We've got over 10,000 students in total at the University of Northampton, over 2,000 of which living in student accommodations, so nearly 2,500. So 3, it's a very, very small number in comparison to the overall student population.
Yeah, I'd just like to echo that point. The university team's been working closely, particularly since the freshers have been coming back with the university, to engage and educate and advise. And I think there's been some video filming, etc., down there to try and make the new guidance and the rules absolutely clear. So yes, this is a small pocket, and our hope is with the activity that we're doing with the university, this will send the correct message out, and we shouldn't have similar occurrences. That's the hope.
Appreciate that. Thank you very much. Becky, I'm really sorry to be stubborn about this. I want to come back to it one more time. When I asked about the cases, we said initially that we can't give details on individual cases because that identifies people. That's fine because we don't want the details of individuals. When asked again, it was that we don't give details on cases that are on outbreaks that are cases that are less than 5. That's okay. But when there are outbreaks that are less than 5, we're at least told that there has been an outbreak. I mean, it is specifically to do with the University of Northampton. It's very important to a lot of parents. Can you please tell me, have there been any outbreaks at all since the return of students? And can you tell me how many cases have been identified? I think it's very important for parents to understand.
Alistair, thank you for the question. I mean, I do feel Becky has answered that previously, so I don't feel we need to push her on that unless Becky wants to make a comment. But Rosin, did you want to comment on that question? I mean, I think we have covered it, to be honest, unless you're desperate to come in, Becky. But Rosin.
I was just going to note that now that we are reporting just numbers of outbreaks according to settings in the data pack, that will be made available, and that is being reported. So any outbreaks specifically will be reported in those that data pack.
Thank you, Rosin. That's quite clear. Alistair, I think that's a very clear answer to that question.
I've got to say, even with the data pack, I'll come to that as I say, but I'm just looking for a yes or no answer. Have there been any outbreaks at the university since the 2 weeks have come back?
I don't feel that we need to answer that question unless I think Rosin and Becky have already answered that question. So I'm sorry. I
don't believe so. I think we've been told that we can't answer it, but we've also said there are 10,000 students at university and that we haven't had an answer yes or no if there's been any outbreaks. I think it's a simple thing. Are there been any outbreaks since we've returned?
Well, I beg to differ. I do feel they have both answered that question. I don't want to be difficult, but they have answered that question already. So I'm afraid I don't think I'm going to push them to answer that one. Thank you, though, for the question, Alistair. I do appreciate it. I'm just looking around the room to see if anyone else has a question unrelated to outbreaks in universities, if that's okay. Let's have a look. Doesn't appear so. Oh, Carly. Hello, Carly. Hi.
Hi. Yeah, it's to Roisin, really. The national hospital rates have been rising, and that's something that's been out on the government data website. I was wondering whether it's data that we are able to get in relation to Northamptonshire's hospitals, and whether the admission rates are rising within both of them.
That's probably a two-part answer, if that's okay. So Rosin and Joanne, if you don't mind chipping in on that one, that would be great. Rosin, over to you.
Yeah, no problem. So we certainly have seen in the last month or so slightly more cases, COVID cases in the 2 acutes than there were in previous weeks and months. However, that hasn't been the kind of increase that has been seen in other areas in the country. So we've seen a slight increase, not on the scale of the other areas have seen. In terms of whether that data can be published, so I'm aware it's published nationally and I believe regionally, but I'll have to check with data colleagues whether it's certainly something that anyone involved in the incident management looks at daily. Whether we can publish that data, I'm not sure, so I'd have to take that away, if that's okay.
Thank you, of course, and you know, we're not in the business of hiding data. If we can share it, we almost certainly will. So, Dr. Watt, did you want to make a comment on that?
Yes.
You're at the whole thing.
So I think it's fair to say that most cases are mild and managed in the community, but we are seeing a slight increase. We are not at the level where we were with multiple cases within intensive care that we were in within the first phase, but it's beholden on all of us to adhere in order to prevent that. So this is our opportunity to prevent a similar situation with multiple cases of patients extremely unwell on intensive care units. We all remember it from last time, and obviously we had our local hospitals featured on national news looking at that case. So I think the focus now is really about prevention. We're hoping that we don't end up back in that situation. Certainly other hospitals are finding themselves with increasing numbers of cases elsewhere within the region. And so we are not there yet, but we are monitoring the situation extremely closely. And this is our opportunity to work with members of the public to prevent that from happening and to protect our friends and loved ones.
Thank you, Rosin. Thank you, Dr. Watt. Carly, did you want to ask any further questions on that? Or
No, it's fine. Thank you.
Thank you very much. I'm just looking around the room to see if there are any more questions. Alistair, your hand's still up, but I presume you've put that down now. And Carly, you've already asked your question. So I am inclined to click. Jonathan, did you want to come in?
Yeah, thank you, Ian. And I just wanted to, and forgive me, we spent a bit of time on it, but I hear Alistair's frustration. I know that'll be shared by others, but I also know in front of me on the screen of the panel have a bunch of people who are absolutely keen to be as frank and open and honest as they can be across all areas. But like I often get in the job that I do, you sit there with your openness torn against the massive amount of regulation and rules and what people are constantly telling you can and can't do, and there's a clear answer to that. But may I just suggest that we issue to Alistair, we review where we are, we issue to Alistair what exactly that policy is, what it's guided by. Promise to Alistair is you'll get that, and you'll get that in the full spirit of openness, but ask from Alistair is you have to stick to that once we've made that clear what that is. I don't know whether a couple of email paragraphs after a bit of reflection would allow Alistair to better understand the guidelines that we're all stuck within, possibly. Really important that the press people who take the time to come along and spend their time with us do realise that trust is genuinely there, and that we're operating as openly as we can. Is it possible to initiate something of that sort of statement of some kind?
Yes, I'm absolutely sure we can probably do that. Rosin, I don't know whether anyone's on from comms. Is anyone on from comms? I'm sure we can do that amongst ourselves. Rosin, would you be happy to issue that?
I think that sounds like a really good idea. Thanks, Councillor. Yeah.
And I think, as Jonathan says, we're not trying to be difficult with Alistair's question. It's just that the constraints are such that it's not always possible to share the information. So there was certainly no desire to not share anything with anyone. It's just one of those things. So we will get that information out to you, Alistair, and hopefully that will solve the issue from your angle. Claire, did you want to come in?
No, I'm just going to say, I think it would be something that we can definitely follow up just to get some clarity for everybody, so that when they're coming to this these sessions, they do know exactly the limitations that we're working within. But I reiterate, we are trying to be as open, but act within the guidelines.
Thank you, Claire. Thank you for that timely reminder. And that's absolutely true. This is a team effort. It's not them against us or us against them. This is a prime example of how across all areas we are working very hard together, including with the press, to help get this transmission rate down in the county and indeed in the country. So I think, unless there are any other questions, I'm going to close the meeting. Thank you very much, everyone who's attended. Thank you for the questions, as always, from the press. They really are important. Thank you for the councillors and all the other members of the panel that have attended today. And we'll see you, presumably, this time next week for a similar round of questions and answers. And I would like to say, stay safe, everyone. Have a lovely weekend and follow the rules. Together, we can get the better of this virus.
So, sorry, and it's Alistair again. Just one more time. I want to come in because I'm having some microphone difficulties. I want to say thank you to Jonathan and the other everyone else who's come in today. Will be able to provide that guidance. To have that just out loud, is that there will be guidance about why we can't have the yes or no answer on what the situation is at university? I'm happy if that's the case, but just to be out loud, will you be able to give me some guidance about why that can't be answered?
Yes, I think that will be clear from what you get, Alistair. And we all have to follow that guidance. So it's worth bearing that in mind. Thank you again. Thank you, Alistair.
Thank you very much, then.
Thank you. Well, I will now close the meeting. I've already said goodbye to everyone and have a lovely weekend. I will say it again. Thank you very much. Have a lovely weekend.
Bye. Bye, everyone.